So I think you want to look at the measures that you can produce. Look at the ones you reported to CMS if you've already attested, and then look at the others that your EMR can produce, and determine where they sort of connect with the things that you want to do as a practice. So for instance, you've chosen important conditions. Everybody, and everybody but one, 9 out of 10 of you are doing diabetes, 9 are doing hypertension. The third varies. I would say you probably want to, particularly if you're new to QI, take a look at the measures that measure performance in areas that you know you want to work on. 6A also, and this again is not a must-pass, one of the factors is being able to stratify data on patients for disparities, such as race, language, age, or gender. See if your EMR is able to do that. Another way to stratify is payer. You might want to select, for instance, Medicaid or self-pay as a population that is likely to suffer from disparities in care. For the utilization measures, if you don't have any other source of looking at utilization measures, such as hospital days, hospital admissions, hospital discharges, ER visits, those are the kinds of things that you want to look at. If you don't have a source of that through your EMR, you may use reports from health plans that you serve if they cover at least 75% of your population. Okay, and then here's a note that I know Jennifer's practices are aware of. If your practice has recognition from NCQA already as for diabetes recognition program or heart-stroke recognition program, you get automatic credit for some of these measures and for other parts of Standard 6. If you don't yet have that, but you run the measures that are in those programs and find that they're, you're doing really great and you want to apply for those programs, that's certainly an option. I wouldn't recommend trying to apply for them if this is the first time you're thinking about it. I think that you want to just go ahead and march on through with quality improvement and with addressing your important conditions. So that's the first part. 6A is measuring clinical and utilization performance. 6B is looking at measuring patient and family experience of care. And I don't want to say that patient satisfaction is a word to lose, because it's not actually offensive, but it's a word we don't use much anymore, because actually measuring experience is much more multifaceted concept. And as I said, Peggy's going to talk about some of your options there. Then 6C is the must-pass standard, and that's what you want to get started on soon. You want to take a look at where you are, the performance measures that you're able to produce, and use whatever technique makes sense for you. Continuous quality improvement. A lot of the hospitals talk about PI, performance improvement, Lean and Six Sigma. Bob has showed you some Lean methodology in videos and has put a lot of Lean articles into the resources. Or you can just say, okay, we're going to use a regular old quality improvement process. We're going to see where we are, and we're going to think about where we'd like to be and what we can do to improve. If you're thinking about where you'd like to be, particularly regarding diabetes or heart and stroke related patients, patients with ischemic vascular disease, you might want to look at the standards that NCQA includes in those recognition programs, the diabetes recognition program and the heart stroke recognition program. You might find that the numbers are that they expect and that they recognize as good performance are not as high as you might think they are. And then 6D is actually measuring again and showing improvement. A little hard if you're starting now to actually, measure, put something in place and measure again, but it's not impossible, particularly now that you have that capability in your EMR to give you up-to-the-minute information. Okay, I'm going to slide 14 now. This is the patient and family experience standard. And I'm going to turn the microphone over to Peggy Ullman in our Baltimore office to give you some overall guidance on this, and that we will follow that up with a memo with some details. Okay, Peggy?
Okay. Linda, can you hear me?
Yes.
Okay. Hello, everybody. So if you look at slide 14 that we're on now, as Linda mentioned, element 6B is not a must-pass in and of itself, but it's important to 6C, which is a must-pass. So there are 4 components to element 6B. The practice must obtain feedback from patients or families on their experiences with the practice and with their care. Each of the 4 components is worth a point, and you have to meet 2 of the factors in order to pass element 6B. So the 4 different factors are that you have to conduct a survey using any instrument to evaluate patient-family experiences on at least 3 levels: access, communication, coordination, and whole person care or self-management support. The NCQA strongly recommends that you use the NCQA-approved CAPS PCMH survey tool using a certified CAPS PCMH vendor. If you use that, you get an automatic 1 point in this 4-point scale. If you don't use that, then you lose an automatic 1 point in this 4-point scale. Number 3 is that you obtain feedback on the experiences of vulnerable patient populations. And number 4 is that you obtain feedback from patients and families through qualitative means. So that would be, doing focus groups or some other form other than a survey tool. So in terms of your options, trying to figure out, I don't think I have, Linda, I don't think I can drive the presentation. If you can flip to slide 15.
Sure. And Peggy, I just would emphasize these subjects: access, communication, coordination, and whole person care or self-management support. Those last 2 that you may or may not find in other survey instruments.
Right, right. So if you use the NCQA CAPS PCMH survey and you use a certified vendor, you're going to be meeting all of these points because they obviously designed their survey to meet this. If you don't, you have to make sure that it meets the other standards. So on slide 15, you'll see we've laid out your different options for counting, for doing a patient experience analysis. 1, you can continue a survey that you're already using, but you need to make sure that it covers access, communication, coordination, and whole person care. 2, you can field the CAPS PCMH survey in September or October. That's the timing that, that the vendors are on. 3, you can field another survey using another survey vendor that's not the specific CAPS PCMH survey. 4, you can develop and field a survey yourself. Or you can use non-survey means, interviews, focus groups, walkthroughs, suggestion boxes, that kind of thing. And in any of them, you know, one thing that is very important and that feeds into 6C is making sure that you're assessing, that you have some mechanism for assessing racial and ethnic disparities. And there is a memo that you know, has a little bit more detail and has some links to the specific vendors that we've done some research on that we will be sending out to you as well, so that you have the detail on, you know, who the vendors are and where to find the information.
Peggy, would you just, for instance, mention some of the other surveys that are available besides the CAPS PCMH survey and how they differ, you know, looking at care, looking at a visit versus looking at a year of care?
Okay. Yeah, so some of the surveys, some of the other surveys that are available are the CAPS CG, which stands for Clinician or Group, and CAPS is the Consumer Assessment of Healthcare Providers and Systems. It's an AHRQ developed survey originally, so if you go onto the AHRQ website, they do have a list of the various surveys, including the CAPS PCMH survey.
They do, and they do have the actual instrument itself. That the instrument, if you're interested in using a CAPS survey, the instrument is free. The questions are free. Working with a vendor is not free.
Right, right. Another popular survey tool is the Patient Satisfaction Questionnaire. This is called the PSQ. It consists of 80 items and measures 6 aspects of care. There's technical quality, there's interpersonal manner, communication, financial aspects of care, time spent with a doctor, and accessibility of care. There's a short form version called the PSQ 18, which takes approximately 3 or 4 minutes to complete. And I have a link as well in this memo to the PSQ 18 survey and the scoring instructions. There's also another survey. I'm sorry, what?
Yeah, so that's one, for instance, that if a practice wanted to field a survey itself.
Right.
PSQ is a good possibility.
Right. Right.
Okay.
Yes. So you could definitely do that in the. You could definitely use the PSQ. Again, going back to keep in mind you're going to, you know, you lose that automatic 1 point of it not being the CAPS PCMH NCQA approved survey.